Dr. Varmus, I would like to take this opportunity to thank you for your passion, time, and hard work you have committed to global health initiatives. Your vision for the NCI Center for Global Health continues to resonate throughout the world. As the co-director of this year's Global Health Catalyst, I'm happy to say that your never give up attitude and perseverance has paid off. I'm so honored that you are able to be part of this year's summit for us to recognize you for all your accomplishments. You deserve it. Thank you.
For this evening's session, it is my privilege to recognize the very special contributions of Harold Varmus to progress against the global cancer problem. Of course, Harold earned a Nobel Prize in 1989 along with Michael Bishop for his discovery of the cellular origin of the cancer-causing gene in Rous sarcoma virus. This discovery laid the initial foundation for precision targeting of cancer-specific driver gene products that has produced and is continuing to deliver a new generation of cancer treatments that are ever more effective, ever less toxic, and ever better at reducing cancer morbidity and mortality. But not content with these considerable laboratory research achievements, Dr. Varmus went on to serve as the director of the National Institutes of Health in the 1990s and later as the director of the National Cancer Institute from 2010 to 2015. Parenthetically, he led Memorial Sloan Kettering Cancer Center in the intervening years, successfully recruiting a number of notable cancer scientists, including the great Hopkins molecular biologist Tom Kelly, cancer immunologist and Nobel laureate Jim Allison, and my old medical school roommate and Lasker awardee Charles Sawyers. Dr. Varmus's accomplishments at NIH and NCI were many, including the establishment of PubMed Central, the building of a new clinical center, and the very prescient launch of a vaccine research center, just to name a few. But most importantly, in both of his public service posts, Dr. Varmus was a tireless and consistent advocate for global health research, hoping to impact global health threats like malaria, like human immunodeficiency virus infection, and of course, like cancer. And he has continued to promote global health research ever since, working with the Bill and Melinda Gates Foundation, the International Biomedical Research Alliance, and the Global Alliance for Genomics and Health. I first met Harold Varmus at the old Aspen Cancer Research Conference many years ago when I spoke in a session along with Rudolf Janisch about the emerging field of cancer epigenetics. I was thrilled that he asked me a question. But I was later lucky, as the Cancer Center director here, to work with Harold more directly when he returned to Bethesda as the NCI director. I even got to see one of the Genes and Jazz performances he does with his son at the Kennedy Center. Dr. Varmus is now the Lewis Thomas University professor at Weill Cornell Medicine and senior associate at the New York Genome Center. Harold, thank you for all you've done to promote research to improve outcomes for cancer, not just here, but also throughout the world, overcoming disparities and barriers, anything in the way of advancing a global health agenda. Thank you, Harold.
I am Elias Kagabo. I am a young catalyst, graduated and now working as a biomedical engineering specialist for Partners in Health in Rwanda. Thank you for initiating and championing global health. Because of people like you, awareness of disparities in raw resource countries around the world has grown. Congratulations on our recognition at the 2021 GHC Summit.
I'm Ari, and I'm in 6th grade, and I enjoy writing stories. I noticed that you were an English major, and now you're a famous scientist. And this teaches me that I can write stories to help children around the world learn about cancer.
Hello, Dr. Varmus. My name is Vanessa Wilson. I am the founder and president of Sakona, Inc., the lead pastor of Good Shepherd United Methodist Church in Willingboro, New Jersey, and a 2-year breast cancer survivor. I salute and congratulate you on this evening's special award recognition by the Global Health Catalyst Summit. I would like to thank you personally and professionally for your scholarship and landmark research in the area of cellular mutations and cancer. As a woman diagnosed with ER-positive breast cancer, your research has had a profound impact on both my diagnosis and subsequent treatment. This, along with your leadership in the National Institutes of Health and National Cancer Institute, has been a blessing to many. Your lifelong commitment to using science to advance health, wellness, and accessibility has changed the lives of thousands of cancer patients and their families. I thank God for you and all that you have done and all that you continue to do. May God bless you.
Greetings, Dr. Varmus. My name is Andres Diaz. I'm a second-year medical student at the University of Arizona College of Medicine. I'm also one of the Global Health Catalyst Youth Ambassadors, and I work closely with Dr. Asana and other ambassadors to promote medical education and science education among young students, especially those who are underserved. Now, as an aspiring pediatric oncologist and bone marrow transplant researcher, I've drawn a lot of wisdom, expertise, insight, and motivation from your incredible groundbreaking work in cancer biology and oncogenes. I've also been inspired by the way that you advocate for education and academia, and have always admired how you integrate your work as a doctor, as a physician, and as a scientist to fulfill public health efforts. Now, when I learned about your interest in English literature as an undergraduate student, as well as your work as a newspaper editor for your school, I was reassured that there's a place for other unorthodox students like myself who are also committed to journalism and writing and English literature, and who ultimately hope to integrate these interests into their work as physician scientists. Overall, I just want to thank you for being such an incredible role model for myself and for many others, and I hope to continue your legacy of scientific excellence and service as a member of the next generation of physician scientists.
And I also have the special privilege of being able to congratulate Dr. Harold Varmus on receiving this year's Global Health Catalyst Award, and to say how important it has been to be able to count on a Global Health and Cancer Institute at our National Cancer Institute. It was founded just over 10 years ago, thanks to the vision and dedication to global health and global cancer of you, Dr. Varmus. And we're happy, so happy to be able to celebrate those 10 years, this decade of work, but also all of us are thrilled and very grateful to count on that center as a place from which we can get support and engage in so much of the work that we do globally.
Hello, Dr. Varmus. My name is Yuri, and I have recently been preparing for college. I've been considering majoring in the sciences, and just seeing all of your accomplishments as a scientist have really inspired me. Awards such as the Double Helix Award, the Nobel Prize, being appointed the director of the NIH. All of these accomplishments have shown me that there can still be great contemporary scientists and have really inspired me to do the best that I can. Thank you so much for all of your work.
Congratulations, Harold, for the award and the great recognition for all the effort you have done. And thank you for the great work done in low and middle income countries through your leadership in the NIH and the NCI, which improve the research on cancer care, control, prevention, and palliative care. So it's a legacy for all people working in the cancer field, and a leadership example for the new generation. So thank you so much for all you have done, and congratulations again.
Hi, my name is Johanna Wirz, and I'm a medical student at the University of Ulm in Germany, and I'm planning to specialize in radiation oncology. In 2019, I did an internship at the Dana-Farber Cancer Institute in cooperation with the Harvard Medical School, and thankfully I got into contact with the global health movement. Because of your work in establishing global health at national and also international levels, I can pursue a career in oncology with an awareness for global health. I plan to continue my work with doctors all over the world and support cancer care in low and middle income countries. Thank you for your inspiring efforts in global health and congratulations on your award.
Hello, Dr. Varmus. My name is Dr. Amaka Lashevikon. I'm a clinical oncologist with the University of Nigeria Teaching Hospital, Enugu, Nigeria. I'm also the national president of the Association of Radiation and Clinical Oncologists of Nigeria. It is my singular honor and great pleasure to bring you this goodwill message and congratulatory note to you on the occasion of your award and recognition at the Global Health Catalyst event. Looking through your profile, it is definitely something worthy of emulation. You bring us, the young and upcoming oncologists, a desire to achieve more, to be impactful in all that we do, and to reach deep within us, to be able to bring out all that we have to affect lives. Indeed, your time at the NCI and the CGH has helped us to flourish in no small ways. You have been instrumental to the rapid development of global oncology, and to this we are very grateful. I also serve as the chair of the African Cancer Research and Control ECHO, which is an online community of practitioners, leaders, advocates, researchers, and people interested in working the National Cancer Control Plan at the country level. Now, this forum was put together by the NCI. It initially started as an on-site meeting and has progressed and blossomed to an online community where we engage with and meet with each other to discuss challenges that we see and we encounter, as we implement our National Cancer Control Plan. Now, that community has been a great resource to us, and again, it is by the singular honor and will of the NCI and CGH. So you have impacted us on the African continent in no small ways, and to this we are grateful. On this occasion, I wish you well, and I join the rest of the world to congratulate you on your very well-deserved award. Bye-bye.
Hi, I'm Gabby, and I'm in 9th grade. I think it's really cool that you were appointed by presidents because you were so good at your job. As a leader, everywhere you went, you made things better. You brought in new money, constructed buildings, and started new programs, such as the Global Health Program, which has helped people around the world. This has inspired me to become a leader and make a change in the world for good.
My name is Shreya Patel, and I aspire to become an oncologist who practices with a focus on clinical global health. Anyone with a passion for the intersections of oncology and global health knows the importance of the leadership, courage, and innovation that has been exemplified by Professor Harold Varmus. I am especially interested in cancer virology, and in the future hope to study the role of viral oncogenes in the prevalence of childhood cancers in low and middle-income countries. This type of work would not be possible without Dr. Varmus's pioneering discoveries in the fields of oncology and virology. Dr. Varmus, congratulations on your recognition, and thank you for all of the knowledge that you've granted to the field of global health.
Today, 12 November 2021, we are broadcasting from Johns Hopkins University, Washington, D.C., US. I am Ahmed Zawawi. I am recording here from Port Said, Egypt. Today is a great day for us, really, because it is a ceremony of recognition of Professor Harold Varmus by the Global Health Catalyst. I am one of Global Health Catalyst who have the honor to present words of recognition to our honoree of today, Professor Harold Varmus. Let me modestly introduce myself. I am Ahmed Al-Zawawi. I am Chair Global Health Catalyst Win-Win Movement, Chair of Board of Directors of Global Oncology University. I am President of ICDOC Experts in Cancer Without Border, was the president of Aortic African Organization for Research and Training Cancer. I am locally here in Egypt. I am Professor of Clinical Oncology, Suez Canal University, Chairman of Al Suleiman Radiation and Clinical Oncology Center, Port Said, Egypt. And this is my email and this is the websites to know more information. But this is not the topic today. The topic today is to recognize Professor Harold Varmus. It is a great honor, really, to Global Health Catalyst to recognize Professor Harold Varmus, the former director of National Institutes of Health and National Cancer Institute, who set up the NCI Center for Global Health. Professor Harold Varmus, really, we are honored. And really, I am personally honored because I am among you today with my colleagues in presenting this recognition to Professor Harold Varmus, a co-recipient with Michael Bishop in 1989 Nobel Prize in Physiology or Medicine for discovery of cellular origin of retroviral oncogen. His great achievements are well-known in scientific communities. You can find it easily in the web. In fact, the honor is ours. When I refer particularly today for the following points that go with the notion of the Global Health Catalyst Win-Win Movement that aims at the increase of affordability of better value cancer care via scientific approaches for millions of underserved patients in the world, regardless of their nationality, color, religion, or ideology. Professor Varmus initiated novel grants program in NCI for addressing provocative question in cancer research. This is very interesting, very really, there is a great need to posing and trying to answer many provocative questions regarding the challenge of affordability of value-based cancer care in the world. We are in great need to this important issue. Moreover, in low and middle income countries, we are really in all countries, we are in need for this provocative question. It is beneficial in all domains of life for finding innovative solutions for obstacles that hinder progress of these countries. Professor Varmus has criticized the high cost of many modern cancer drugs. This goes with completely with the win-win movement of the Global Health Catalyst. He advocates for genetic testing of cancer as a routine reimbursed procedures and for wider use of the information that genetic testing of cancer can provide. He argues for widespread use of panel tests and exome analysis to identify cancer-causing mutations. And this would be simpler and cheaper than full genome analysis. Yes, and he is hopeful that researchers will soon use new technologies to move beyond the study of primary tumors, where we have and the world have considerable success, and to explore how cancer initiates and the development of metastatic cancer. Finally, on behalf of the faculty of Global Health Catalyst, movement, please allow me to have the honor to cordially congratulate Professor Harold Varmus for his great achievements. And I ask him kindly to accept to guide the Global Health Catalyst Win-Win Movement. Professor Harold Varmus, please accept the expression of my deepest respect and best wishes of health and profound, peaceful, and productive life to serve more and more the humanity and science. Thank you all.
I want to acknowledge Dr. Harold Varmus. I first worked for Dr. Varmus as one of many people working for Dr. Varmus at the National Institutes of Health in the 1990s. It was at that time that Dr. Varmus really helped to educate me and make me understand a lot about health disparities, especially as it relates to genetics and about being a real scientist and looking at the real scientific questions. I want to congratulate Dr. Varmus for his recognition at this meeting.
Hello, we are students at the University of South Florida Judy Genschaft Honors College.
In our global health class, we are learning the fundamentals of holistic health and how they can impact the world on a global level.
We have been taught how to identify and access credible resources for global health research and practice.
Among these is the National Cancer Institute's Center for Global Health, which you initiated.
Professor Varmus, congratulations on your recognition at the 2021 Global Health Catalyst Summit.